Hey everyone, welcome back to another lesson. This lesson is on medications to avoid if you have an enlarged prostate. And these medications are important to avoid because they worsen symptoms associated with an enlarged prostate. So symptoms including lower urinary tract symptoms like issues with intermittent urinary stream or issues starting urination or issues with urinating at night. So these medications are important to avoid if you want to improve your symptoms. So a lot of the medications we're going to talk about in this lesson come from the article entitled Contribution of Common Medications to Lower Urinary Tract Symptoms in Men. So the first class of medications we're going to talk about that's important to avoid if you have an enlarged prostate is antihistamines. So antihistamines are commonly used for treating allergy symptoms, so things like allergic rhinitis. And it's been found that using antihistamines can worsen lower urinary tract symptoms, or LUTS, associated with benign prostatic hyperplasia, BPH, also known as enlarged prostate. So it's important to try to avoid using antihistamines. Some examples of antihistamines include Benadryl, also known as diphenhydramine, the generic name of Benadryl, Claritin, which is also known as loratadine, and Zyrtec, which is also known as cetirizine. So these are common antihistamines that are used oftentimes for treating symptoms of allergies, and these can actually worsen symptoms associated with an enlarged prostate. The next class of medications we're going to talk about is decongestants. So as its name suggests, decongestants reduce or improve congestion associated with oftentimes respiratory tract infections, but also with allergies. These may also worsen those lower urinary tract symptoms associated with an enlarged prostate. So again, issues with intermittent urinary stream and issues with frequent urination during the night. Some examples of decongestants include pseudoephedrine, phenylephrine, and we can also see decongestants in nasal sprays, but a lot of times nasal sprays are not going to lead to significant issues with symptoms associated with enlarged prostate unless nasal sprays are being used very frequently. So again, two classes of medications to avoid with an enlarged prostate: antihistamines. Examples include Benadryl, Claritin, and Zyrtec, and decongestants, including medications to help with congestion that contain pseudoephedrine, phenylephrine, and even some nasal sprays if they're used frequently. Another class of medications to avoid with an enlarged prostate is nonsteroidal anti-inflammatory drugs, or NSAIDs. So there's actually some conflicting data with regards to the use of NSAIDs in prostate enlargement and associated symptoms. NSAIDs, or nonsteroidal anti-inflammatory drugs, include ibuprofen, naproxen, and aspirin. So ibuprofen, you can think of Advil or Motrin. And these are used for pain relief. And there has been some data that has suggested that NSAID use, or use of these types of medications like ibuprofen, naproxen, aspirin, can lead to prostate enlargement and a worsening of associated symptoms of an enlarged prostate. So important to either reduce or try to avoid NSAID use. I know it's difficult with some conditions that have issues with pain control, but again, this is one class of medications that could lead to worsening prostate enlargement and associated symptoms. Another class of medications that can worsen symptoms associated with enlarged prostate include opiates, or opioids. So opiates, the reason why they can worsen symptoms associated with an enlarged prostate is because they can cause constipation. And constipation itself is what can lead to worsening lower urinary tract symptoms. So again, opiates can lead to constipation, which can worsen lower urinary tract symptoms. So with opiates, it's important to use laxatives to avoid constipation and avoid worsening of lower urinary tract symptoms. Examples of opiates include morphine and hydromorphone, or Dilaudid. And again, nonsteroidal anti-inflammatory drugs like ibuprofen, so you can think of medications like Advil and Motrin, other ones including naproxen and aspirin. These could lead to increased or worsened prostate enlargement and worsened associated symptoms of an enlarged prostate. So it's important to try to reduce or avoid use if possible. And then opiates are another class of medications that can worsen lower urinary tract symptoms associated with an enlarged prostate because they can cause constipation, which is oftentimes an issue in causing or worsening symptoms associated with enlarged prostate as well. Some other classes of medication that are often prescribed medications, so it's important to consult with your physician, include the following: tricyclic antidepressants, or TCA. So tricyclic antidepressants are an older generation of antidepressants. So they may be used for depression or for other conditions, including neuropathic pain and fibromyalgia. More likely they're used for neuropathic pain and fibromyalgia than they are for depression, but they could be used for depression as well. Examples of tricyclic antidepressants include amitriptyline, nortriptyline, doxepin, and imipramine. And another class of medications that can worsen symptoms of an enlarged prostate include diuretics. So, as mentioned before, caffeine is a diuretic, and it leads to worsening symptoms because there's increased volume and frequency of urination, so it can worsen the symptoms or the sensation of symptoms. And diuretics are utilized for a variety of very important health conditions like congestive heart failure, chronic liver disease, chronic kidney disease, and hypertension or high blood pressure. So these medications are very important. And as mentioned before, they increase urination and urine volume. Therefore, they can increase symptoms associated with benign prostatic hyperplasia or an enlarged prostate. So these are medications that should not be avoided. These should be discussed with your physician, but it's important for completeness sake in this lesson to tell you about these, that they can worsen symptoms associated with enlarged prostate. So again, tricyclic antidepressants, very important for use in neuropathic pain disorders and can be used in fibromyalgia, and they include amitriptyline, nortriptyline, doxepin, and imipramine. And then diuretics, and diuretics are used for very, very important health conditions like congestive heart failure, chronic liver disease, chronic kidney disease, etc. So if you want to learn more about foods to avoid if you have an enlarged prostate, please check out my lesson on that topic, and also check out my lesson on supplements and foods to eat to prevent having an enlarged prostate in the first place. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. Thanks so much for watching, and I hope to see you next time.